Good morning. I've got 10 o'clock, so we're going to go ahead and get started with the webinar. My name is Victoria Beal with the Ohio LTAP Center, and we are so very pleased to be able to partner with the ODOT Office of Transit and our partners at the Department of Developmental Disabilities to host for you this morning a Medicaid eligibility webinar for Ohio transit agencies. We've got an excellent team of presenters for you. This morning we have Stacy, Laurel, and Kathryn who will be presenting for you. Just a couple of housekeeping items before we get started. And it sounds like most of you have already done this, but if you are just joining us on the phone line, we do ask that you please mute your phone line by either using the mute button on your phone's keypad or pressing *6. If you don't have a mute button, you can press *6 on the phone's keypad, and that will mute your phone line. It helps to cut down on background noise for our presenters as they work through the presentation for you this morning. When we get to the end of the presentation, we will have a question and answer period, and during that time, if you have muted your phone using the *6 feature, you can then press #6 to unmute and ask questions. You'll also notice on your screen that there is a chat pod in the bottom left-hand corner. You can use this chat pod to put questions in that will then be answered by the presenters during the question and answer period. You do not have to wait until that time to put questions in the chat pod. You can feel free to put them in any time during the presentation. And last but not least, right above the chat pod, you'll see a file sharing pod named Files 5. In that pod, we have for you 3 different documents that you can download. One is a copy of today's presentation as a PDF, and the other are 2 guides that our presenters will be talking about during the presentation. In order to download those files, you would click on them one at a time, and that will activate the download file button that's probably currently grayed out on your screen if you don't have one of those files clicked, and then you'll be able to go through the process of downloading the file. With that, I'm going to go ahead and turn things over to our presenters. Stacy, are you and your team ready?
We are, Victoria. Thank you so much.
Thank you.
Good morning, everyone. Thank you for the opportunity to present this morning, and we appreciate your attendance on today's webinar. Before we get started, we'd just like the opportunity to thank the Ohio Department of Transportation for asking us to present this morning about some of the things currently happening within our system here at the Ohio Department of Developmental Disabilities. So we appreciate it. And wanted to do a quick introduction for everyone here who's in the room with me, who'll be doing the presentation with me for all of you. And so, of course, I'll start off with myself. My name is Stacy Collins, and I work here at the Ohio Department of Developmental Disabilities and am the Employment First lead with our team. I also do a...
Sure. Hi, this is Laurel Geist. I'm the waiver administrator for Developmental Disabilities. And I'm Kathryn Ingles, and I'm the manager of the Provider Certification Department for DODD.
Wonderful. So we are very excited to be here with you this morning. Just wanted to quickly go over what we plan to cover in our hour time together. So we're going to just start doing a quick introduction about our services and about the Ohio Department of Developmental Disabilities. And then we're going to lead into talking about our vision and priorities for services. And then we wanted to give you some federal updates of things that are impacting services here in Ohio. And then we'll end today's presentation with talking about provider certification, in particular around transportation services that are available within the DODD system. So lots to cover. Hopefully it is of interest to you, and we address some questions that you have. So just to get started, wanted to talk about who we are. And so the Ohio Department of Developmental Disabilities, we are Ohio's Medicaid sister agency, and we administer services, we certify providers, and create opportunities for Ohioans with intellectual and developmental disabilities to really participate fully in community life. And you're going to hear a lot about community life as we move forward in our presentation this morning. And our mission at the Ohio Department of Developmental Disabilities is really about continuous improvement of the quality of life for Ohio's citizens with developmental disabilities and their families. And within that mission, we of course have a vision where we want to make sure Ohio citizens with developmental disabilities and their families experience lifestyles that provide those opportunities for personal security, physical and emotional well-being, full community participation, productivity, and equal rights. And again, like I mentioned just a moment ago, you're going to hear a lot about that full community participation within our system right now. And so what we do oversee, so the Ohio Department of Developmental Disabilities oversees a statewide system of supports and services for more than 90,000 people with developmental disabilities and their families. We are responsible for developing services that ensure an individual's health and safety, again, encourage their full participation in their communities. We provide and making sure the services provide meaningful opportunities for employment, and as well as provide residential supports and supports for early childhood through adulthood. We really have services that start from basically birth and they go all the way through somebody's life. With what we do as well, our responsibilities here, and I often refer, we always have our acronyms, and so you're going to hear me say DODD. That's how we often refer to ourselves. So here at DODD, we provide leadership oversight and funding for 88 county boards and thousands of individuals and families. And so you'll hear us talk about today, when we get to the funding slide, that within the Ohio Department of Developmental Disabilities and within our state system, we do have our county boards of developmental disabilities who have funding involved in services and oversight to services. So within the actual services that we have available to individuals with intellectual and developmental disabilities, the services are intended to be based on need and always need to be documented in somebody's what we call service plan, and our term that we use is the Individual Service Plan, ISP. And also the counties within the state oversee those services, authorize those services, and sometimes as well offer a broad range of services so individuals can access all aspects of life. And so a lot of the services that you'll see are about doing daily living activities, so helping somebody with eating, getting dressed, helping parents aid in their children's development. We have services around preparing for and working at a job in the community, and of course making sure that we have services that help somebody get around the community for work, fun, or errands. And so again, a very broad range of services that are currently available within our system. And so with this slide, I'm going to pass it over to Laurel to talk about the different types of funding that are available for those services.
Thanks, Stacy. So in our system, historically, we've had services that are provided, like we said, in the community, and the whole idea of community, home and community-based waiver services is based upon the idea that why should someone have to live in an institution if they can get some supports, they can live in their own home and in their own neighborhood with people that they know and trust and are a part of their life. So we have three waivers to deliver those types of services to people with intellectual and developmental disabilities. We also have a program of facility-based care. In some instances, people do feel more comfortable in what we call ICFs, intermediate care facilities, and that is the other branch of DODD. And of course, there are always locally funded services. So those issues that come up on your local levies for money for your county boards of DD, fund services that are not covered by the waiver, not provided in those facilities, but are important to people living in the community, living a full life, and having physical and emotional well-being. So over the past couple of years, the worlds of waiver services and the worlds of facility-based care have come closer and closer together as we find the best option for each individual person living with the supports they need and being able to participate in the community, find employment, and basically being able to pursue their dreams and their goals. So when you interact with the DODD system, you might not see too much of a difference between the different kinds of
funding and then what people are doing out in the community. So like I said, the waiver programs, they live in a community setting of their choice. We do incorporate the ideas. We have some great advocates and advocacy organizations in Ohio. They have had a loud voice in developing our services, so people directing their own services within their need-based budget is very important to us here in Ohio. Funding and services are based on each individual and determined by a standard needs assessment tool. So with any Medicaid program, the services that are covered through the waiver are based on what you need, what you require to be able to be living fully in the community. Individuals can hire and remove their own service providers, so I think you're seeing a trend here of people making decisions about their own lives, not just what they want to do, but who is helping them to achieve those goals. And that can be really important because if you are trying to reach a goal, but you might have some supports that are not helpful to you, or you feel like you need different supports to be able to change and meet that goal, being able to have that control over your own life is crucial to meeting those outcomes. Facility-based care. I mentioned that some people live in intermediate care facilities or the state-operated developmental centers. The facility provides all the services as well as room and board, and the funding is owned by the facility. So I mentioned the two worlds of waiver and ICF moving closer and closer together. Sometimes the individual moves out into the community through a waiver. Sometimes they secure services and funding through an opening at a different ICF or at a DC. And if that other facility they're interested in has an opening, they move over there, and then someone else can come into their spot at the facility. So we have lots of different options for people, where they live, what kind of residence, to support the outcomes that they've mentioned in their ISP. Stacy mentioned earlier, we do have a lot of acronyms, but their individual service plans and what they want to get out of their lives. Last, locally funded services. So people living in the community-based settings, and to some extent people in many other settings, receive services from their county board or another organization. So people on the waivers, getting waiver services, get services from the county board. People who do not receive waiver services also have support through the county board or another organization. So in Ohio, we have 88 counties. Of course, we have 80 different models of what kind of services are available, but generally they include day services. What do you do during the day? Are you preparing for employment? Are you learning some life skills? They include transportation and school programs. So those three are really standard across all the counties. In some form or another, the county board connects individuals to accessing those services.
Perfect.
So after talking a little bit about our system and our mission and vision and the services that fall under the Ohio Department of Developmental Disabilities, with that, of course, wanted to make sure you knew, and this is Stacy again for those on the webinar. It's really about, of course, DODD, the oversight sets the rules, but then there's multiple funding streams that come into how those services are paid for and how they're delivered and what options are in the communities and each county. And the county board's role is such an important role in regards to supporting individuals and their families. And so I know that we're here today to kind of give that bigger picture of the Ohio Department of Developmental Disabilities. That's really going to be important, and I'm sure all of you are engaged with the county boards in the actual counties that you're in, because they are crucial and necessary in all of our system of supports for individuals and families. So the next part of our presentation this morning, I really just wanted to talk about some of our priorities here in Ohio in regards to those services that are offered to individuals. And we are going through a time where I don't know if the best word to use is a time of change, but definitely going through a large shift within our system, in particular around the home and community-based waiver services, but really our overarching service philosophy as well. And so the priorities of our practice, of course, is what we call person-centered planning. And person-centered planning is really, it's pretty easy, just how it says. It's about the individual being the center and in control and the leadership in setting their plan and the services that they need and the outcomes of those services. And so it's really important for us. We're doing a lot of training and support across the state, and many of our county board partners are as well, around that person-centered plan and how are we talking about what is important to an individual, what is important for an individual, so of course that health and safety, and how are we identifying those needs and then identifying the outcomes of our services. And then also in Ohio, priority is community employment. And so we currently have the Employment First initiative that was implemented in 2012 by an executive order from Governor Kasich that for individuals with developmental disabilities, community employment is that preferred outcome. With community employment, that doesn't mean that 100% of people, there's an expectation, will be working in community employment, but that we're really working towards working age adults working. And when we talk about employment, it's really working in the community, so with individuals without disabilities in a competitive job where they're making minimum wage or higher, and they're getting the same level of benefits as somebody without a disability. And so there's lots of focus, and it's been lots of attention and resources put into really making sure we're getting working age adults working and the opportunity to work. Of course, if somebody says, I don't want to work in community employment, that is absolutely okay. We want to make sure that we have services and supports for that as well. And then community integration, or what I like to call community membership. And so we've been talking a lot around within our system that priority of making sure the individuals and their families that we're supporting, that the individual with intellectual and developmental disabilities is, again, having that opportunity to become contributing members of the community in which they live. And so a lot in particular around the home and community-based waiver service is about making sure that we're helping individuals engage and connect with their communities. And so you'll see, if you haven't already started to see those priorities across our system, and it's really, again, at that time of change within our system currently. And really the targets of those priorities are multiple different things that are truly centered around the individual. And those targets are about how are we supporting the individuals with intellectual and developmental disabilities and making sure that we're helping them as having stronger connections with those around them, with their community, making sure they're getting better benefits, that we're working to improve their health, enhance their quality of life, to really increase their self-esteem, expand their natural supports, and develop their abilities. And so it's really about helping that individual meet all of those targets as much as possible. So just wanted to take the opportunity to review those, the priorities and the targets within our system. And then I'm going to pass it back to Laurel to talk about the federal landscape and some things that are happening within our system that's in line with these changes.
Thanks, Stacy. So as Stacy mentioned, Ohio is already on the path to implementing some of these person-centered planning changes. I really like the phrase community membership and community integration, and that has been the focus of the Centers for Medicare and Medicaid Services, which oversee all the Medicaid agencies in the United States, of which Ohio Department of Medicaid is one, and then we mentioned we are the sister agency specifically for intellectual and developmental disabilities. They put out a rule, the HCBS, so Home Community-Based Services Rule, and that rule was centered around the idea of community membership. So in the past, people with intellectual and developmental disabilities have been isolated or segregated from the rest of society. Part of that is because sometimes people had perceptions about people with intellectual and developmental disabilities, about things they could or could not do, that were not based in fact at all. They were just stereotypes. And as we as a society have been breaking down some of those barriers really successfully, we wanted to make sure that our infrastructure and our systems were set up to support full community membership. So this rule came out, and we started working with CMS really in 2014 on implementing this rule and changing our system and our structures to support community membership. One big tenet of the rule was conflict of interest. And some of you may have heard this before, like we hear it in the news if someone is sitting on the board of a company and they're asked to make a decision that impacts that company's profit. You'll hear in the news, they didn't disclose their conflict of interest. This is similar, but not exactly like that. So let me explain it in the context of person-centered planning. It's easy to understand what person-centered planning is. It's planning around the person's desired outcomes and goals. The tough part is changing your mindset to help accomplish those goals. So, for example, county boards are the hub of support for individuals in their area. County boards provide case management service, which is someone who helps you do that person-centered planning and choosing services to help you achieve those goals. But oftentimes, the county board in the past has also provided the services that they are recommending in the person-centered planning. So the provider of this case management cannot be the provider of the home and community-based services funded through Medicaid, according to the conflict of interest rule. In Ohio, we saw at the beginning that we were about at county boards providing 50% of the day services and transportation. So 50% of the time, the services that they were planning were also being provided by them. They were essentially referring people to themselves. But there is a lot of variation. So I've heard about 20% in some counties, up to 70, 80% in other counties. And part of the reason we're doing this webinar is because county boards, obviously, to come into compliance with conflict of interest, are looking for other providers to provide those services, because county boards will be retaining the case management service. And for those of you who have services in those counties where only 20% of the services were provided by the county board, you might not have heard as much already, because the county board has a lot of options. For counties where 70% of their services, they have to get a whole bunch of transportation ready to be available for people in their county. You might have heard something already. So don't be surprised if you haven't heard something or you have heard something. There is a lot of variation between the counties. And this slide goes over what I just said. So there's case management and waiver service delivery, so the actual services. You can't do both. Also, county boards cannot have new entries into services. So as we are phasing out county boards out of providing services, they aren't adding new areas in which they're providing services, which makes sense. We have until 2024 to completely transition county boards out of services. And that seems like we have a bunch of time, but when we first started looking at dividing case management and services, it was 2009, and the way we did that was to give people who did the case management and people who provided the services different bosses. So it's taken us 7 years to get to this point, and then we have until 2024. So I do think that we'll see some increased momentum towards accomplishing these goals. I mentioned over 50% of waiver services are provided by county boards. And I think it's important to say that the conflict of interest is not a conscious decision on the part of the county board. No one is saying, oh, great, I can get some more money by putting this transportation service on Laurel's plan, and then that money comes right back to me. They're just outgrowths of the system as it was created. that may or may not be promoting the best interest of the individual receiving services. So by separating these two functions completely, we avoid a lot of that unintentional consequence area, and this structure will help us resolve that. So what does this look like? That's really high level. What is this going to look like in real life? Right now, some of you may contract with county boards of DD, and when people make their service plans, it'll say, you know, Buckeye County Board of DD, 100 units of transportation service to Laurel's plan. In the future, it would not be contracted with Buckeye County Board of DD. It would say local transit authority, well, I'm not going to say Wolverine because this is Ohio, local transit authority, Brutus, 100 units, Laurel service plan. So even though it looks like a small change on paper, it really is a big change in making sure that we're meeting the conflict of interest compliance. We've heard a lot of questions about what this looks like in real life, and some people are already doing this, and I'm excited to hear if you have a story about how you are a provider already for DODD, or you're a Medicaid provider already, how you've been integrating this. But I think a key difference is also that people with disabilities and without disabilities might be on the same bus, but you might be providing a different level of service to the person with disability. So door-to-door or an aid. You might also, that's a big difference, right? You might also see smaller differences. One of the waivers, the self-waiver, allows people to purchase, something that they can do is purchase a bus pass in order to get to and from work and things like that. So you might not even know in that case that that person has transportation funded through DODD. That might not make a difference. In other cases, you'll see a big difference. And I certainly don't have all the answers about how this will look, but I am excited to see what the creative ideas out there are to make this a reality and move our system towards meeting the conflict of interest compliance and giving everyone full membership in the community. And we do have a couple questions. That's why I paused. So I'm going to read these while Kathryn talks about our provider certification.
I think if I can add really quick, this is Stacy. Wanted just to add, as we talk about the conflict of interest, it's going to be really important, as Laurel already mentioned. Each county is going to be different in regards to what services they provide and how they need to transition out of the services. And so it's really going to look different across the state. And so I think I just wanted to stress that as we talk about this, it's really going to be important, if you haven't already, to connect with your county board, to have the conversation around what does that look like in your identified county, and what are the identified needs and service needs of that county, because again, some of the counties are going to need large amounts of support where some counties aren't providing services, a very minimal amount. And so again, the local conversations are going to be really important.
And additionally, the questions I'm seeing, the answers to some of those may depend on how the people are funded who are being transported. So again, I would echo Stacy's sentiment to work with the individual county board who has more knowledge of those funding streams that I covered earlier, and can provide you those answers about specific groups of people. Yeah, it's going to look really, really different depending on different situations.
Yeah, because it does definitely, especially when local funds are involved, the county board does have the control over those funds. And so that is, again, where that conversation needs to occur. Let me move the slide, please. Oh, so we're going to pass it on to Kat now.
Good morning, everyone. I manage the provider certification department. So what we wanted to do was provide you with the overview information about applying to become a provider if you or your regional transit authority decide that that is an option that you would like to pursue. Again, echoing off of what has just been said, it is really important to link with your local county board. They're going to be your resource of a lot of information when it comes to applying and what services to apply for and the process. But I will give you, in this part of the presentation, an overview and where you can access the information, where you can find the information. I'll also point out that in the download list, there is a document, a PDF document called the Provider Certification Transportation Guide. And if you download that, it has hyperlinks in it that will take you to all of these screens in our system that I'm going to be showing you on the slides. And then, you know, either now or in the future, when you're looking to become a provider or start to look into it, you'll have those links to take you directly where you need to go and where you can find the information. So this first slide is the highest level of when you're looking at becoming a provider with the DODD system. The two rules that you're going to want to look at are the provider certification rule and our background check rule. So as agencies, you'll be paying attention to the rules regarding the agency providers, because we have independent providers and we have then agency providers, and you guys would be falling under the agency provider. Now in these rules, you're going to find the service definitions, and that even includes for all of the transportation services. I'm going to show you those rules next, and all the rules have the service definition so that you can see what exactly is this particular service that I'm considering applying for. You'll also find in the rules the provider qualifications that will have to be met in order to become a provider, and then you also find the general requirements for service delivery that would also need to be met in order to be a provider. As an agency provider, you're also going to have to comply with a background check rule for all of your employees providing services to individuals with developmental disabilities. And so that's why that background check rule is also included. And again, when you open the PDF, you'll be able to click on either of those hyperlinks and it will take you directly to the rule. Now this slide shows the 4 rules that we have that cover our various transportation services that you may want to consider applying for. And as stated previously, it is important to also work with your local county board in discussing which services may be the best for your agency to provide. And each of these rules, again, have the service definitions, the provider qualifications, and then the general requirements for service delivery that would need to be met for those services for each of them. This is our page on our website for new providers. And so you can, through the PDF document, click where it says website link, and it will take you directly to this page. And that way you don't have to go to our website and then navigate to it. This will take you directly to the page. It has general overview of information that you'll need to know in deciding and applying for services through DODD. The next slide is when you scroll down, it's below the fold on this same screen. And one thing that I will point out with our application process for a new agency, there is the requirement of Medicaid that they conduct a site visit. And so I want to let all of you know that that can be a time-involved process. So once you apply with us and go through the certification process, and we have approved for providing services, we then send the application and information over to the Ohio Department of Medicaid. They contract with a third party who comes out and conducts a Medicaid site visit. And then after that process is finished, then when we get the response back from Medicaid about certification, that's when we can then finalize the certification. The site visits that Medicaid conduct, they generally tell applicants it's between 30 and 120 days. The reason there's so much variation is that sometimes, especially for new startup agencies, when Medicaid goes out, they may request a plan of correction, and then they allow time for that plan of correction to be met before making a final decision. But the site visit is a requirement by Medicaid for them to issue the Medicaid provider number. At the bottom of this screen, you'll see where on the lower left-hand corner, where it has the link for becoming a provider. When you're an agency, you would be clicking on the highlighted section that says, I want to become an agency provider. I'll also point out on the bottom of the screen on the lower right-hand side is a link for locating the contact information for your local county board. And I've got some screens following this that show both of those in a little more detail. So from that lower part of the screen where you would click, I want to be an agency provider, on the PDF that I provided you, if you click right there, it will take you to that section of the application also. So when you click that, this is the page that you'll be on, and it's a step-by-step instruction on how to become a provider, because it will involve you setting up a user ID with the Department of Developmental Disabilities, and in order to access our electronic application system. And we call that system PCW. It stands for Provider Certification Wizard. So you'll set up a user ID, and then from there you can access the application online and complete the application online, and also upload your documentation that will be needed for reviewing in order for us to certify you for services. And this screen you'll see at the bottom, it will give you steps 1 through 5, and it walks you through the process. And then when you click on the link for the county boards, it's going to pull up a page that has the map of Ohio with all of the counties. You can either click directly on the county on the state map, or you can use the scroll bar to the right on the page and find your county in the list and click on it there. The website will then load up all of the contact information for your local county board. It'll appear, you'll just scroll down slightly and you'll see the contact information where it is all listed. And then you will have them to use as a resource for becoming a provider.
All right. So we wanted to make sure that we left a lot of time for everyone to ask questions that they may have. And so we've been looking through the actual chat box here with questions. So I'm going to ask at this point, if you have questions, if you can enter them into the chat box so that we can start going through them. Hope that you found the information that we provided useful, and I hope that everyone will stay on the webinar with us this morning as we go through these questions. Right now, what I'm actually seeing is some individual specific questions regarding, in particular, it looks like from Stark County. And so what would be helpful is if, for those couple questions coming in particular, I really think that our next step should be to actually connect all together with Stark County regarding your questions. And so what will be helpful for me, again, this is Stacy Collins, is whoever is the lead coming out of Stark County and the Stark Area Regional Transit Authority. If you could do me a favor and give me your email address, what I would like to do is schedule a conversation with actually Bill Green, who is the superintendent in Stark County with the county board, just to go through with some of your questions, because the questions are leading me into kind of some questions around funding and all of that. So again, this is Stacy. I will absolutely make that connection so that we can start having the conversations about what might be happening in that area. So if you guys could give me an email address of who the right person is to reach out to, you'll be hearing from me later today.
I'm seeing, this is Laurel, I'm seeing questions about DD clients could not be transported with other riders. And I apologize in advance for saying many times during the next 10 minutes probably, it depends. So when you talk about other riders, if you're talking about just the general public, there are some situations in which they would not be being transported with the general public. If I don't want to say with other riders, I don't want to say that other riders could not be transported with them. Sometimes people have aides that travel everywhere with them. Of course, we would want those people to be transported with the person that they are serving. And so that is a little bit of a broad statement, and you can be more specific in your question if you like. We also have a question about, we were talking about waiver funding, not local funding. So yes, to get waiver payment for waiver services, you would need to become a certified provider with DODD. Not all transportation provided to people in our system is funded through the waiver. Sometimes there are local funds available, and I did not want to leave that out of the bigger picture. So that was the reason that local funding was included in this discussion. You are totally correct that we are primarily talking about waiver funding, how to become a waiver provider and get reimbursement for those services. And we're just reading further down.
I wanted just a question came in here actually about a unit of government. So can a unit of government be a provider? And my response to this one is this is something that we really need to have more information on in order to answer the question. The reason is that that's a very open question, and so it's going to be very difficult for me to answer. So I have no problems if it's maybe I'm going to make sure everybody has my email address. If there's a question that we can answer, that you can send it our way. But that question in particular is it's prompting me back to multiple different questions that I don't want those webinar attendees that are here. It'll take too much time. So again, I'm willing to make sure you've got my information.
And as we see the relationships and structures develop in some of the counties that have a little more experience, we would like to share that information with all of you. I see some people requesting that the outcomes of those conversations are shared.
I have no problem doing like a kind of an FAQ sheet for everyone, if that would be helpful as we go through these changes together.
And regarding where the line is on this kind of stuff, I would encourage you to think about the foundation for this rule. So the people who are planning the services, who are speaking with people in their families, helping them set up plans, identifying gaps in reaching their outcomes. A barrier for you with a job is that you don't have consistent transportation to work, you keep being late, and your boss says that they're really sorry, but they're going to fire you. Separating that conversation from, look, I'm going to give you the transportation. So separating that from the actual provision of service, that is the underlying principle that we want to establish through these structures. Shouldn't there be consistency between counties? That's interesting. So what we have found is that what works in some counties absolutely does not work in other counties. And as all of you know, the counties in Ohio look a lot different from each other. So I would say, no, there shouldn't be consistency between counties. There will be some common threads, but consistency is not necessarily my goal in all of this. My goal would be that the county sets up a relationship that separates them from the provision of services, and that might look a little different. So that was an interesting question.
We got a question, and I don't know, Laurel, if we covered it or not, as I was looking through these questions about the benefits to becoming a Medicaid provider. And so what I just wanted to mention is, so the question that came in was regarding what's the benefit to becoming a Medicaid waiver provider versus local dollars for funding, and if that really is, as an organization, a decision that I feel like each organization has to make on your own. And so so services can be provided through multiple different funding streams, even outside of our system. And so it's just deciding what's the steps and requirements necessary to go through provider certification, what is the reimbursement structure for those services, to decide what route you go. The one thing with just relying on local dollars versus Medicaid dollars is that is one funding stream that would be available to be able to serve more people. But again, as a organization, that's going to be, or an entity, that's going to be your decision on what is that positive, what's the positive, what's the negatives of doing it. But again, it allows you to be able to serve more people and to grow your trips that are happening within the community. And really, it's going to be important for us. I mean, we're really trying to make sure that we are helping individuals connect to community employment, connect in their community, and transportation, as you know, is such a big piece of this. And so we're really glad to be here to be able to talk about, to build that relationship with you.
We have a couple people typing. Oops, I'm just going to give them a second.
This is Victoria. I just wanted to chime in too and remind everyone that, you know, if you have dialed into the audio, that you can feel free to unmute your phone line to ask a question of the presenters, and you can always mute your phone line back again to listen to the answer. You don't have to just type it in the chat pod.
And I am seeing that Sandusky has had, the city of Sandusky, which is where my family is from, has had some success in the final stages of approval. So I am hearing that you have some bright spots in your group of people who are already doing this. If we are considered public transportation, we can't restrict who rides along with the DODD client. That's correct. So if it's a public transportation service that someone is accessing, just like me, a person without DD services would access, then it would be public transportation. And of course, you know, the aide would ride along with the DODD client. That's correct. I'm going to scroll down. And I wanted to make sure, did everyone see, Kathryn shared the map of Ohio, and on the handout you can access the county board contact information through that map. The questions I'm getting, and Stacy has said this before, and I know people want an answer that works for everybody, but I can't say one way or another if one strategy is better than the next, because it really depends on the structure of your county board and what your county board already has in place. So in order to contact those people, it is on one of the handouts, and I want to make sure everyone got it. Under certain circumstances, DODD client. And to clarify, I see Pam is saying that I said under certain circumstances the DODD client may not be able to ride with the public. It's the difference between accessing public transportation and using transportation that is specifically for a group of people. Maybe they're funded through the waiver, maybe they're funded through local services.
So they can ride together. I want to make sure that they
right.
absolutely can ride together. So what I need to do is, so there's a couple questions that are kind of looming here that we need to follow up with you on, and we will. So we can do, my proposal is to do it this way, is there's two questions in particular that we will get back to those who attended today. And so, Victoria, if it's possible, if I could get the actual information to you, would you be able to distribute it out to those who are on the webinar?
Absolutely. Everybody who registered provided me their email address, so I'll be sending whatever you would like forwarded on out that way. And I'd like to remind everyone, too, that we did record this presentation, and I'll be sending out information probably in a couple of weeks when that recording is published on our YouTube site for viewing.
And so the two questions, just to follow up with the attendees on the webinar, if I'm seeing and processing all of the questions appropriately, there's really just two that need to be addressed. One is the question around city government, being the actual provider of service. I see a combination of city government and county government. And so one of the challenges is the county boards are typically, they fall under that county government. But I will get consult on that question and we'll get that information back to Victoria. And then the second question that we get multiple answers on is, can fees be different? So someone who is a public transit rider versus a DODD Medicaid rider, can those fees be different? We did get that question to us just a little bit before this webinar, and so we will get back to you on that answer.
I see Marvin has shared that in other states like Maine, there's more integration identified in the transit needs study, and maybe my colleagues have seen that study, but I haven't. So in return for our FAQs, if Victoria, you could share that transit needs study with us, I would be interested in reading it.
I will work with Lana in our Office of Transit to be able to get you whatever it is that you'd like to see from ODOT.
Excellent. And I know we have more questions than answers today, but I am eternally optimistic, and it says to me that we are actually interested in developing these business relationships and being able to achieve our conflict of interest goals. So I wish I had all of the answers for you today, but I don't. But your questions will help us think about how we can talk to the county boards and get the conversation going. So I do thank you for that. Oh, thanks for the link, BCRTA.
And then I wanted just to confirm really quick that Latrice is the contact for Stark, the Stark area. I'm thinking so, but it's hard to scroll through all the questions. That's my plan.
She says yes.
Oh, perfect.
Great.
Thank you.
Thank you.
Great. Well, at this point in time, we're going to go ahead and conclude the webinar. We thank you for joining us today, and as I'd mentioned earlier, a recording of this webinar will be made available and a link emailed out to everyone. We look forward in the future to hopefully hosting more webinars on various transit topics so we can continue to provide the learning from your desktop without you having to leave the agency. And thank you again to our presenters. We sincerely appreciate your time and efforts in putting all this together.
Thank you.
Take care.